Hello everyone. Today we'll explore one of the most effective and widely used approaches in modern psychotherapy, cognitive behavioral therapy, commonly known as CBT. Cognitive behavioral therapy is a short-term goal-oriented form of psychotherapy. It is evidence-based and extensively researched, making it one of the most trusted methods for managing a range of psychological conditions. CBT is designed to help individuals understand the interconnection between thoughts, feelings, and behaviors. It focuses on changing negative patterns of thinking and behavior that contribute to emotional distress. Now, we'll see some key features of CBT. First, evidence based. Numerous studies support its effectiveness for conditions like depression, anxiety, PTSD, OCD, and more. Structured and time limited. CBT typically spans a few weeks to a few months depending on the nature and the severity of the issue. Collaborative. The process is active and engaging, involving both the therapist and the client in identifying problems and developing solutions. Now, we'll see how CBT incorporates a variety of techniques. What are the modalities in CBT? First, cognitive techniques. These involve identifying negative automatic thoughts and cognitive distortions and replacing them with more balanced and realistic thoughts. Behavioral therapy or techniques. Methods such as exposure therapy, role playing, and behavioral activation helps individuals face their fears, break avoidance cycles, and build effective coping mechanisms. Third, biopsychosocial interventions. These focus on stress management, lifestyle changes, and improving relationships and environment to support overall mental well being. Now, we'll see how the therapeutic process in CBT typically follow the steps. The first step is assessment. The therapist work with the client to identify current challenges, thought patterns, and behaviors contributing to distress. Second, goal setting. Together, they define clear, measurable, and achievable goals for therapy. Intervention. The therapy introduces and applies customized cognitive and behavioral techniques to address the client's need. Homework and assignment. Clients are encouraged to practice skills learned in therapy session or between the session or before the session. This could involve thought logs, behavioral experiments, or relaxation exercise. Fifth, evaluation. Progress is regularly monitored. The therapist and client evaluate outcomes, adjust techniques if necessary, and develop a relapse prevention plan.